Okay, so the force field analysis is just going to compare the forces for change, forces against change, and then talk about the change proposal in the middle. So our change proposal to decrease risks, to decrease falls in the emergency department are to develop a new effective fall risk assessment tool specific to the emergency department. So specific to intoxicated patients, altered patients, whatever it is. So specific to ED patients. And then also to educate and enforce focused hourly rounding, bedside report, and handoff report every time with every patient. So I didn't really go over focused hourly rounding. Focused rounding includes the 5 Ps, which are pain, potty position, personal items nearby, and pathways safe and clear to the bathroom. So it's kind of one of those things where if you peek in and you think of those 5 Ps, that's focused rounding. You make sure that everyone, you're dealing with the pain in the potty, the patient's position, and then whether they're personal items and there's a clear pathway to the bathroom. So having to educate the staff about those things is all part of the change proposal. So when you think about forces for change, it's kind of a no-brainer. You go with patient safety, patient satisfaction. Those are super important. They're the center of our nursing practice a lot of the time. Well, patient safety definitely is, and patient satisfaction is something that you would like to achieve, but sometimes you can't, but you try your best. And then you talk about forces against the change. So most of this is just time to implement the change, time to educate the staff regarding the assessment tool, teaching them about focused hourly rounding, and mostly difficulty enforcing rounding and handoff reports, just because it's easy to have an in-service or have some sort of seminar or whatever it is trying to educate nurses, but old habits die hard, and you have a lot of nurses that are quite often resistant to change. So you kind of you do what you can, but most of the time, that's mostly what the forces against change are going to be, is just time and difficulty enforcing it. So, but still, patient safety and patient satisfaction trump the forces against the change. I think that will always be the case. I think patient safety is going to outweigh a lot of the stuff. Even when you think about, I know that you're going to have to come up with financial stuff and different things to try and implement these things, but it's patient safety, so it's again the center of our nursing care. So that's pretty much it. I hope you guys enjoyed my presentation on patient falls in the ED. I hope you guys have a great Christmas vacation, and Merry Christmas. Bye, guys.